Hello, good evening, everyone. Welcome back to my Fences and welcome back to our webinar tonight. I'm glad that you were able to join us once again, and I hope that you are ready to learn or maybe hear some new things already tonight, or maybe you will be able to simply ask your questions and get some answers. And as you can see, our guest is right here, Sofia Rodrigues. Hi, Sofia. How are you?
Hello, I'm fine, thank you.
You were able to join because if some of you have seen Dr. Paula Manso was supposed to be here tonight. Unfortunately, she wasn't able to make it, but luckily we were able to invite Sofia, and she, of course, will talk about non-invasive PGTA, which is definitely something new. This is definitely a promising method, and Sofia has prepared a presentation. She will discuss this. And let me just mention that Sofia is the clinical embryologist at Ferticentro, Coimbra. So she's a colleague of Dr. Vladimiro Silva, and I'm sure some of you already know Dr. Vladimiro, who is the CEO and founder of Ferticentro. And if you've seen some webinars when it comes to Ferticentro, I am sure that you have found those useful, and I'm sure it's going to be very interesting tonight. This is, as I mentioned, a new method. This is something that I know you've been asking even in our previous webinars. So I'm glad that we will be able to fully focus tonight on non-invasive pre-implantation genetic testing. And as always, remember, this is recorded. Sofia will start with her presentation, but afterwards there will be time for your questions. Just put those in the chat section after the presentation is done. I'm sure Sofia will be happy to help you out with any questions you might have. So don't forget to put those. Yes, I believe that will be it from me. Let me just add that my Aviafences is a part of European Fertility Society. And as you know, we are simply here to give you some answers, to provide you with some new methods that are available, but also give you the opportunity to make informed decisions. Because if you are here, that means that you are looking for some answers, you are looking for some options, maybe some options that are not available in your countries. So there are, as you know, many webinars we've done so far, and there are still more to come. So thank you already, everyone, for joining us tonight. I do believe it's going to be interesting. And Sofia, that is it from me. Let's go ahead with our
Okay,
presentation. Ready?
okay, I'm ready.
Brilliant. Thank you so much, then. Go ahead.
Well, okay, now I see.
Sure.
So thank you for the presentation. Okay, my name is Sofia, as Caroline has already told you, and I'm here to talk to you about the non-invasive PGTA. Okay, so first of all, I want to explain to you what PGTA is. So PGTA means pre-implantation genetic testing for aneuploidy. Okay, and PGT-A is a genetic test performed on embryos to screen for numerical chromosomal abnormalities. And an embryo is considered to be aneuploid when it has extra or it is missing some chromosomes. Okay. These kind of embryos that are missing these or having extra chromosomes often fail to implant, and they lead to usually miscarriage. And if implantation is successful, it can also lead to the birth of a child with a genetic condition, which is not what we pretend at all. Um, and in the opposite, embryos that are found to be chromosomally normal are referred to as euploid embryos. And these are the ones that are more likely to lead to a successful pregnancy and to give place to a healthy
Hi, everyone. Apologies. It seems that Sofia will be back in a second. I already see she has been able to join us again. So give us a few minutes, hopefully seconds, and she'll be back. Sofia, let me know if you can hear me already. Apologies, everyone. This is a live event. Things like this can happen, but I hope that Sofia will be able to get back to us as soon as possible. Sofia, let us know if you can hear me. All right, so I will try to get in touch with Sofia, so please bear with us. I'm sure we'll be back. So just give us a few seconds to fix this. Thank you.
Okay. Okay.
Hi guys, we are back.
Hello. I'm so sorry.
It's okay. It happens, of course. So everyone, we are sorry for this, but now we are back on track. Sofia, go ahead. Okay. Thank you.
Okay, I'm so sorry about this. So hopefully everything will get back to normal again. So I just explained to you what PGT-A is, and what we pretend with PGT-A is to find, of course, euploid embryos. Okay. So usually we do the PGT-A before the embryo transfer, so that we can know more information about the embryos before we transfer them to the patients, so that they can do an informed decision about the treatment and about the embryos to transfer. However, PGT-A it's not doesn't make the embryos better. Okay, the embryos are what they are. We just get more information with the PGT-A, and we have the advantage to gain the capacity to select the best embryo to transfer. And of course, by knowing that that embryo is genetically normal, we can of course reduce the number of cycles that are needed in order to obtain a pregnancy. Okay, because we know that we are selecting an embryo that is genetically normal, so hopefully he will give place to an healthy baby. So here in Ferticentro, where I'm an embryologist, we do, of course, the PGT-A to several patients, And we use a next generation sequencing, which is a specific genetic method in order to know what the DNA of the embryos. And this technique allows us to analyze all the 24 chromosomes of each embryo. So, and how do we do the PGT-A? So, in order to do the PGT-A to an embryo, we must do a biopsy. Okay, and the biopsy consists of of removing some cells directly off the embryo in order for them to be genetically analyzed. So, in order to do the biopsy, we should have embryos in the blastocyst stage, and this stage is reached on day 6 or day 5 or day 6 of culture of the embryo. And only the embryos that reach this stage and with good quality are okay to be biopsied. Okay, in order to do this, in order to remove these cells, we use a laser system to open a little hole in the blastocyst. And then we just remove some cells, like you can see in the image. And these pieces of cells are going to be sent to the genetic laboratory, and they will be doing the genetic analysis, not us. We just do the biopsy itself. And then cryopreserve the embryo and wait for the result of the biopsy. So, but is the PGT-A really useful? So there are a lot of studies about the PGT-A, and this is just one that can show us that PGT-A can be really useful. This is a study from Genomics, where it says that a woman with age between 38 and 40 years old that are undergoing IVF treatments have 64% chance to have aneuploid embryos. Okay, as you can see in the graphic, the rate of aneuploid embryos increase with the increment of the maternal age. So as much as old as the mother is, the higher the chances of the embryos to be aneuploid. Okay. This is another study from Genomics also. This is a clinical outcome with and without PGT-A. Okay, so we have here different rates: implantation rates, delivery rates and transfer, and miscarriages rates. The blue bars are the treatments where PGT-A were used, and the yellow bars are the treatments where they didn't use PGT-A. And as you can see here in the implantation rate, the rate of implantation increases significantly when we do the PGT-A in relation when we don't use the PGT-A. Also the same in the delivery rates per transfer. You can see that there is a higher rate of deliveries when we do the PGT-A. And also we can see that there is a decrease in this case of the rate of miscarriages when we do the PGT-A, because we know that we're transferring only good embryos and genetically normal embryos. Okay, so I think it makes really sense to do the PGT-A in order to get a pregnancy in a shorter time. But I'm here to talk to you about the non-invasive PGT-A. And the non-invasive PGT-A is a new technique that is in study, where we can actually know the genetics of each embryo without touching the actual embryo, without damaging the embryo, because the biopsy of the embryo itself is a pretty invasive procedure, and it's really risky for the embryo, because you may not resist the biopsy, and we can lose the embryo. Okay, so it's a pretty risky procedure. And this new technique has a lot of advantages in relation to the traditional PGT-A. And how do we do that? So the embryos are in a culture medium where they are going to grow, okay, until they reach the blastocyst stage. During that time, during the culture days, the embryo naturally releases DNA during their development. And what we are going to do is to collect that culture media and send it to the genetic laboratory, where they will search for DNA and search for the genetics of the embryos and see if they are genetically abnormal or not. Okay, so this gives us basically the same result as the traditional PGT-A, but we don't actually touch the embryo, which is a really good advantage of this new technique. But is it effective, or is it as effective as the traditional PGT-A? So some studies of iGenomics shows us that this technique can be pretty good. Okay, so iGenomics did a study where they studied 13,000 human blastocysts, and they compared the DNA that was released by the embryo to the culture media and from the real biopsy of the blastocyst. Okay, they just compared these two DNAs from the same embryos, and they found out that there was an average of 78.2% of concordance between these two DNAs of the same embryo. So as you can see here, the concordance between the DNA in the medium and the DNA from the biopsy of the trophectoderm cells was 87.5%. The concordance between the DNA of the medium and the biopsy of the inner cell mass was 84.4%, and which is a really, it's a really good result. 80% of concordance between these two types of DNA, which shows us that this can be a technique really that we can take advantage in the future, of course. Okay, and of course we can conclude that this non-invasive approach can avoid the actual embryo biopsy while giving us the genetic result of the embryo. And although it is still an experimental technique, some clinics already use this as a diagnostic technique. In Ferticentro, we are not using this yet, but we are in the validation phase. So we are now sending samples to iGenomics to see if our samples are concordant enough so that we can use this in the future. And I really hope we have good results with this, and that we can actually use this technique in the future for our patients, of course. Okay. So thank you for watching.
Thank you so much
for your questions.
Thank you so much. Indeed, definitely, it's an interesting method. So I'm glad that you are also starting the project, right? So it's not there yet, but you are working on that, and in the nearest future, I guess it will be possible. So yeah, fingers crossed. It's going to go well, and the results will be good. Because yeah, definitely sounds promising, and it's an interesting approach for sure. Thank you so much indeed, Sofia, for sharing presentation, and you've done a great job. So thanks so much, everyone. Thank you for your patience. And now, as you know, it is time for your questions, your favorite part. And as you can see, Sofia, there are some questions already here. So I will show you the questions one by one. So let's go with this first question here. So is there no risk of thawing, then refreezing an embryo? What are the guarantees? Thank you for your first question.
So, of course, there are risks of thawing and refreezing an embryo. Okay, the cryopreservation and the thawing themselves are really invasive procedures, of course. There are 2%. There are 2% the probability that an embryo doesn't survive the thawing. And of course, there are no guarantees that an embryo won't degenerate after the thawing. And even if an embryo was only cryopreserved once, we can't guarantee that he will survive. And if it is refrozen and rethawed, it is, of course, it doubles the chances of degenerating. But we have some cases in the Ferticentro where we have done that and the embryo survived. Okay, I'm just saying that this is the theory, but in the practice, from my experience, I never had a degenerated embryo that was refrozen, like frozen, double frozen, of course. So, of course, there are risks, but I think if it is necessary, we must take them and accept them, of course, for the best outcome of the treatment.
Of course. Thank you so much, indeed, Elodie, for your question. And if you can clarify, so taking a drop biopsy of culture media from what day?
Yeah, this method, this new PGT-A non-invasive, requires that the embryo is in culture for 6 or 7 days. The blastocyst structure is reached on day 5 of culture. In theory, of course, some embryos take some time more to reach the blastocyst. But in this case, in order to do this, we need the embryo to be in culture for 6 or 7 days. In order so we can have enough DNA in the media to be analyzed. But because we are now starting the tests, I'm not really sure exactly in the practice part how it will be done. But I'm sure the embryo can take one day or more or 2 days more in culture, of course, in order so that we can have that DNA enough to be analyzed.
Okay, thank you, Derek, for your question and for the clarification. This is definitely a difference everyone needs to remember about as well. So thanks for that.
Yes.
And we will go back to PGT-A, standard PGT-A. So what are the risks with PGT-A biopsy?
Okay, so the biopsy, the traditional method, right? The biopsy of the embryos. So there are some risks because we need to manipulate directly the embryo and remove cells of the embryo for them to be analyzed. So the fact that we are actually touching the embryo, it's a risk factor already. And some embryos don't resist that manipulation, that kind of manipulation, and may degenerate during the biopsy. Of course, the risks are not that high, but it can happen, of course. And also, the blastocysts in order to blastocysts to be biopsied, they should have like a good quality, a good morphology in order to be resistant enough to this biopsy. Because if the blastocyst is not so good, the chances of it to degenerate are higher, of course. So, but yeah, there are a lot of factors here that we should take in account to do the biopsy. But I think the benefits are better than the risks, and of course the embryologists have experience enough to manipulate the embryos, and hopefully most of the times everything goes for the best.
Okay, understood. Thank you, Fran, also for your question. And actually, I will go to this one. So which embryo qualifies for the PGT-A or non-invasive PGT-A? Blastocyst quality C and D?
Which embryo quality for PGT-A? So I think for the non-invasive PGT-A, I believe every blastocyst is qualified for it because, as I was saying, the biopsy itself is invasive, also mainly because of the quality of the embryo. And if it's poor quality, if it's a C or D, it's a bad blastocyst. So the risk that it degenerates is higher. So I think those are the perfect blastocysts to do the non-invasive PGT-A because we are not touching them, and so they are going to survive, of course. And if they become normal, genetically normal, of course they are going to be transferred, of course, and they have possibilities to implant. For the PGT-A, for the invasive PGT-A, for the biopsy, I don't think the blastocyst will resist. Of course, we always try to do the biopsy of every blastocyst that we can, and even if they will degenerate eventually, we try to see how they respond, how they react, because they may be resistant also. We don't know, and they can eventually survive. So I won't say that there is a quality of the embryos that are qualified for the PGT-A. I think all of the blastocysts have the chance to be normal because they reach the blastocyst stage. So I think that's the most important thing, because we know that the blastocyst is a structure that the embryo should have in order to implant. So they have a chance. All of them have a chance. So we always try in every blastocyst that we see that has potential to implant.
All right, brilliant. Again, thank you so much for yet another question here and your explanation. Next question, interesting one. Will there be much of a price difference between the two testing types? Are you able to tell us more or less about that?
I don't think so.
Okay.
I'm really not sure about the prices,
Of
but
course.
from my opinion, I think it's more expensive if we do the biopsy itself rather than the non-invasive, because it requires more time and more material and everything. But actually, I can't be sure answering this question
Of course.
because I really don't have a clue about the prices. But I would say
Yes, definitely. Of course,
the
understood.
invasive one will be more expensive, I would say.
So that's even one more point, to non-invasive PGTA, right?
Yes.
But we need to wait a little bit more
Yes,
for the
yes.
details on that,
Not sure.
right? Sure, it's okay. Thank you so much, of course. All right. Do you do washes or day 5 single culture media to day 5 single culture media?
No, in Ferticentro we don't do watches in the middle of the culture of the embryos. We use a single step medium, and the embryo stays on that media until they reach the blastocyst stage, all the days of culture, which I see as an advantage, because by changing the media, we are manipulating the embryo during the culture, and that may influence the development of the embryo. So no, we don't wash the embryo. We just keep him in the same culture media since the beginning until he forms the blastocyst on day 5 or day 6.
Excellent. Thank you so much, of course, for that question. And there is a thank you from Derek for you as well. Brilliant. Thank you. And okay, so you kind of already mentioned that, but when and where will non-invasive PGTA be available?
I really hope soon, in Ferticentro at least. So we are now starting to gather samples because the patients need the samples that we are using to be approved, for us to be approved to use this technique, has some details. It can be any embryo, but now we're starting to join some patients and some samples to send. But I really hope that by in the middle of the year, we can start to use this technique. But we are just now starting to reunite the samples, so I really can't predict
Of course.
when we will be when it will be available to use in Ferticentro. I really
Yeah,
hope
so
soon.
within
Yeah.
probably a few months, it will be possible. But I understand, of course, at some other clinics, some other countries, like in Spain, I believe, they are already doing this as well at some clinics, right? I think. I've heard at least. So you just need to wait a bit, but
yes, there are clinics that are already using this.
Exactly. So
yes, that's right.
Good. Thank you so much. Okay, let me just have a look. There are a few questions
closer.
left. So if you have more, you know what to do. Go ahead, type those in. And here's the next one. So is it only single-step cultural media that can be used for this?
If this person is referring to the non-invasive PGTA, no. Actually, the protocol for using the non-invasive PGTA, it's different, and it requires watching the embryos in the middle of the culture. It requires a changing of the media during the culture. So single step can't be used here. Okay. I'm not sure about the exact protocol right now, but I know that we must change the media in the middle of the culture. So a different medium than what we used should be used for those cases, and that's why we need to study the protocol in order to start to collect samples for the validation of the technique.
Brilliant. Thank you again, of course, for yet another question. 3 questions left. Okay. If you have more, you know what to do. Go ahead. Sebastian, another question here. So is the embryo transfer on day 5 after refreezing and rethawing the day 6 or 7 blastocyst?
I don't think I understand the question. I
Sebastian,
think they are asking if the embryo transfer on day 5, on day 5 of the endometrium, right?
If you can clarify this, okay?
Is the embryo transfer on day 5? Because if we are freezing and thawing the embryos that were freezed on day 5 or day 7, I think they are asking if they are going to be transferred on day 5 after. But that depends on the endometrium. That's more a medical issue. But I believe that maybe we will have to have some more days with the progesterone, so that the endometrium is receptive to these 6 or 7 day blastocysts.
Sebastian added here, yeah, day 5 after start with progesterone.
It's just more a medical issue.
Yeah, of course. Understandable here. Sophia is an embryologist, of course. It's
exactly.
It's definitely okay. But thank you, of course. Thank you, Sebastian, for following up on that one as well. Okay, I'm not sure if you can have. You can have a look at this, but I'm not sure if you can help with that. If the embryo don't resist, is the procedure invoiced?
If they are talking about the PGT-A, I think so, because but it depends on the clinics. In our case, I think the patient. I'm not sure. I think the patients pay for each embryo that is biopsied. If the embryo is not biopsied, they don't pay for it. But I'm just talking about the biopsy. The rest of the procedures, I'm not the ideal person to talk about the financial part of the treatment. I think you can understand why.
Of course, perfectly understandable. So I always advise that if you would like to get more details on prices, etc., you will be redirected. After we finish, we will be redirected to Sofia's profile, and there is an option for you to get in touch with her and Ferticentro team. So customer care, of course, can get back to you with some more details on that. And if you wish, I can always forward this question, to the team. I'm sure they will be more than happy to help you out with even more details. So don't hesitate, okay? And now probably our final question. If there are some more questions you would like to ask, remember this will be like a final call. but as I've mentioned, if you wish to ask anything else, there is also an option for you to get in touch directly with the team. I'm sure they will be happy to help you out with any questions. And the question here: how sensitive and accurate is the genetic testing of non-invasive PGTA in comparison to standard PGTA?
Okay, so as I told before, this is still an experimental technique, and we are not using it already. So, this technique has, although it has the advantage of not touching the embryo, and it's better for the embryo itself, of course. It has the disadvantage of the DNA that is in the media cannot correspond to the actual DNA of the embryo. And another disadvantage is that the DNA that is in the medium that is released by the embryo cannot be in the amount enough in order to be detected in the next generation sequencing technique done by the genetic laboratory. So I believe that the biopsy itself it's a more accurate test. However, I think this technique, this non-invasive PGTA technique, needs more, of course, improvements. And of course, there are already studies, as I showed you, that shows that the results are pretty coherent between GTA is.
Yes, Sophia disappeared, so we just need to wait a second so we can. I see one more question, Derek. Thank you so much. So let's give it a second. I'm sure Sophia will be right back. She just lost connection, but I see that she has joined the room already. So let's give it a minute. And she should be able to. Yeah, you are reconnecting.
Yeah,
Thank you. Sure,
sorry.
it's all right.
I don't know if you heard me. No.
Not the last part. So if you can repeat again, sorry.
So I was just saying that, of course, there are some disadvantages of the non-invasive PGTA because due to the amount of DNA that is in the culture media. I believe that in the future, improvements are going to be done in order to also improve this technique, and I believe that in the future, this technique can actually replace the biopsy due to the advantages for the embryo itself, of course.
We just need to wait a bit more, yeah, and more data, etc., to be able to do
Yes.
that. But definitely sounds interesting and promising. And yes, Derek, as I mentioned, there is one more. I will show you the last question for tonight. So, do you see a difference between hatching versus an expanded only blastocyst?
I must ask difference where, right? Because
Okay.
if it is in the biopsy itself, if the embryo is hatching, it is better for us to do the biopsy. But it's also okay if it is only expanded. If the person is talking about the embryo transfer, I I can't tell you for sure because I will have to see our data in the clinic. But I believe that that the fact that the embryo is in hatching is a really good sign because he is re-expanding after the thawing, or if it is fresh, also. It shows that he is developing, he's growing, he's expanding himself, and so the embryos that kind of movement. I mean, evolution are better to implant, of course.
I'm
But I
sorry,
don't think
Derek. Because added, there is a follow-up, so let me just put it here. If you are doing non-invasive media tests, do you see a difference?
if you were doing I don't know. I don't know, because we haven't done it, so we don't have results in order to answer that right now. But I don't think it will be a critical factor that the embryo is in hatching or not. Of course, is also a good sign for every embryo. I think so. It's a good sign that when they are in hatching, but not specifically for the non-invasive PGTA. But that's just my opinion, and I don't know what are the results. Maybe we will find out when we have all the samples we need.
Of course.
And we can do that test also. We can study that, of course.
Unfortunately, again, we just need to wait and give it more time for the results, to come in. And of course, you will have, you can present them then. So thank you so much, Derek, also for your follow-up here.
Yes.
Sofia, already would like to thank you for joining us tonight. This was like a very last-minute thing for you, so I'm glad that you were able to join us and help us with the topics tonight, which is definitely interesting, still something new, but this is something that will be asking, I'm sure, in the nearest future. Everyone will be definitely interested in this. It's promising. Thank you, everyone, for joining. As always, you never disappoint with your questions, always interesting questions. So thanks a lot. Sofia, there are some thank yous from the patients for you right here. So thank you a lot. Anything else you would like to add before we finish?
You're welcome.
All right, one more thank you.
No, I just want to thank everyone that was watching. Okay.
Okay, brilliant. All right, so we will finish for tonight. So thanks everyone for as well joining.
So I can hear you. So
I can hear you now, but it was breaking a bit, but I think it's all okay. So once again, thank you, Sofia. I just want to mention that this has been recorded. So if anyone missed any parts, and of course you will be able to rewatch this. It will be available tomorrow on our website, My IVF but also on our YouTube channel. So if you subscribe, that way you will be notified that the video has been uploaded. Thank you, everyone. Have a lovely evening. Sofia, thank you for joining. It's been great to have you. This is your first webinar with My IVF so I'm looking forward to some more webinars in the near future with you as well. So thanks a lot, everyone. Take care.
Come back.
Yeah. See you soon then.
Thank you.
Take care. Bye.
Okay. Take care. Bye-bye.
Bye-bye.